afternoon, Noelle. My name's Tiffany. I'm going to be getting a little health history from you today.
Okay.
Doing an assessment. To start this off, I'm just going to check two patient identifiers. Can you tell me your first and last name and your date of birth?
Noelle Resch, 12/18/74.
All right. Do you mind if I take some notes while I do this?
Absolutely.
All right. Well, I see here you're just kind of here for a well person check. Do you have any
Yes.
concerns or anything today?
No particular concerns, just getting over the flu.
So are you feeling all right today?
Yes.
Are you having any pain?
No.
All right. I'm going to start with just kind of a background of your health history, go over some questions. Did you have any childhood illnesses such as like measles, mumps, chickenpox?
Chickenpox.
Okay. And you had all your normal immunizations?
As far as I know, yeah.
Okay. Have you ever had any kind of accident or injury?
I broke my foot in high school.
Okay.
That was it.
Which foot?
My right foot.
Any problems since then?
Nope.
Do you have any serious or chronic illnesses such as asthma, depression, diabetes,
Nope.
blood pressure?
No.
Good. Have you ever been hospitalized?
No.
Okay.
Other than like a surgical tonsils and adenoids.
Okay,
When
that
I was
was-
a child.
Next question. As a child.
Well, I guess I was 20, so kind of as a child.
Okay.
More of a young adult, I guess.
Obstetric history. Number of pregnancies?
2.
And children?
2?
And any problems with your pregnancies?
No.
All right.
Well, I guess I had a little hypertension, but that was it. That's
Okay.
all resolved.
Are all of your immunizations up to date?
Yes.
Okay, including your flu shot?
Yes.
All
Yeah.
right. Which obviously didn't work for your
Right.
flu. And the flu shot you had in September or October?
October, I think.
Okay. Are you allergic to any medications?
Supposedly lidocaine, but I don't
Okay.
know that that's a real thing. It was a dental thing, and I broke out in a rash, and they said I was allergic to lidocaine. But I've had variations of it since then and not had a problem. So
Okay. Are you allergic to anything environmental-wise? Dust, mold, cats, dogs?
not anything particular.
Okay. And do you take any medications currently?
No.
All right. Next, I'm going to go into family history.
Okay.
Anything that you know of, mother, father, brother, sister, any chronic health conditions?
My dad had heart disease and COPD, but he was a smoker for 100,000 years. So
Okay. And your mom's pretty healthy?
yes.
Okay. And your brothers, sisters?
Skin cancers of various types we've all had, but that's it.
Let's go back to that. So you said you've had skin cancer. When was that?
When was that? 2001.
Okay. And which type?
Melanoma.
Okay. And did you have a white excision after that, or just?
Yes.
Okay. And do you still do monthly skin checks?
Yes.
Okay. Use sunscreen?
Yes. Absolutely.
All right. As you know, that's important.
Mm-hmm.
All right. Now I'm just going to kind of go through all your body systems, just see if there's anything, that might be an issue or that has been. Overall, how do you feel? Do you feel
Good.
pretty healthy?
Healthy,
Okay. Been having any problems with weakness, fatigue?
Nope, not since last week.
Okay. And we discussed the history of skin,
Mhm.
this melanoma. Any other problems with rashes? Any?
Oh, occasionally
changes.
little
Okay.
things, but nothing serious.
Okay. Any problems with headaches, dizziness?
No.
Okay. Do you wear glasses or contacts or anything?
No.
Any problems with your vision? Any blur spots?
No.
All right. Have you had a vision check recently?
Yes.
Okay. Again, with melanoma.
Yep. A couple months ago.
Good thing to follow up on. How about ears? Any problems with ear infections, earaches, dizziness, or ringing in your ears?
I have had ringing in my ears today, but that's because my head's full of fluid.
Okay.
I take a little Sudafed and it goes away.
All right. Nose and sinuses, are you still having any kind of
Drainage, you
drainage,
know, all that stuff.
queer?
Yeah.
Any problems with nosebleeds or allergies or anything?
Mm-mm.
Okay. How about any mouth pain, dental pain?
No.
Any bleeding gums, voice
No.
changes? Okay, and you said you've had a tonsillectomy.
Mm-hmm.
All right. And you've had a dental visit within the past 6 months?
Yes. Mm-hmm.
All right. And let's see, you're not old enough for a mammogram yet, but do you do monthly exams?
Yes, of
All
course.
right. Good. Any problems?
No.
All right. Do you have a history of asthma or any kind of breathing problems? Okay. And have you had any shortness of breath or any problems with this recent flu?
Not anymore.
Okay.
Maybe a little last week, but
Just a mild cough. And you've had a negative TB test, right?
Mm-hmm.
All right. Any problems with chest pain, shortness of breath? Okay. And you said just family history of heart disease. Have you had your cholesterol checked recently?
Yes.
Okay.
Last year. It's about time to do it again.
And was it good?
Mm-hmm.
Okay. As far as your legs, arms, do you have any problems with coldness, numbness in your hands?
Why, yes, I do.
Okay. Is the sensation good or?
Yeah. The
Okay.
sensations do. They just get very, very cold and they turn purple.
Okay. Do you have any pain with that?
No.
Have you ever had that evaluated by your
No.
doctor? Okay.
No.
All right. That would be a good thing to mention
Yeah.
next time you see your doctor. Do you have any problems with varicose veins
Yes.
or okay? Lower extremities.
Yes.
Okay. And you are on your feet all the time. Do you wear
Yes.
compression socks?
I do.
Wonderful. Do you have any problems with appetite? Any food intolerance?
No.
Okay. Any problems with indigestion or any other problems with eating?
Nope. I love to eat.
All right. Still have your gallbladder, appendix?
I do.
All right. Any problems with urination, urgency, burning frequency?
No.
Last menstrual period?
I don't have those. I have an IUD.
Okay. And when did you have that implanted?
4 years ago.
Okay. Any problems since then?
Nope.
All
Love
right.
it.
And do you still get your yearly PAP?
Yes.
Okay, good. We ask all our patients about our sexual health.
Mm-hmm.
Are you presently in a relationship involving intercourse?
Yes.
Okay. And routine use of contraception or just IUD?
IUD.
Okay. And any history of any kind of STD?
No.
All right. Do you have any history of problems with your joints, any arthritis, gout?
I do a
stiffness,
little bit in
pain?
my hands. I think
Okay.
work related, but nothing serious.
Nothing that limits you in your daily activities?
Not really. No.
Okay. Do you take any kind of medication for it? or just-
Occasionally, ibuprofen or
Okay.
something like that.
And that works well for you?
Yeah.
Do you have any history of seizures, strokes, fainting, blackouts?
No.
Any weakness one side or the other?
No.
Okay. Any problems with memory, nervousness?
No.
Okay. Also, any problems with depression, anxiety? Good. Do you have any problems with bleeding or
No.
or bruising?
Mm-mm.
Okay. You are exposed to radiation where you work, but you do practice radiation safety,
Yes.
including lead. Okay, good.
Absolutely.
Any history of diabetes or
No.
increased urination, increased hunger, anything like that? Okay. Any history of thyroid problems?
No.
All right. And you said you work in the medical profession.
Yes.
Is that correct?
Mhm.
Okay. So, do you have any problems with your day-to-day activities with work?
No.
Spend a lot of time on your feet?
Yes.
And do you push, pull,
Yes.
lift? Okay.
All of
Any
the
problems with
above.
that?
No.
Let's see. And as far as education, how?
I have a bachelor's degree.
Okay.
and I also have an associate's degree.
Alrighty. If any of these questions are personal, feel free. You don't have to answer any of them. Do you have a relationship with the church or any
Yes,
kind of
I'm
religion?
Catholic.
Okay. As far as activity and exercise, do you do anything to keep active?
Yes, I do. I
Okay.
exercise probably 6 days a week usually.
Excellent. Any problems sleeping or?
Not unless my husband's snoring.
Okay. All right. Good. Any problems with nutrition or anything? Okay. And how would you describe your role with your family?
I'm, like as far as I'm a mother and
Okay.
a wife and like
And so you said
I-
you have
two children. Mm-hmm.
And do you and your husband both work?
Yes.
Okay. Do you have a good support system? Somebody if you
I
have
think so.
problems?
Most of the time anyway.
Okay.
Yes.
All right. You said you have a good relationship with your church.
Yes.
Any abnormal stresses or anything that ever
Not
feel
really, no.
overwhelming?
You know, work can feel overwhelming occasionally.
Okay. Do you smoke?
No.
Okay. Do you use any kind of recreational drugs?
No.
Alrighty.
Alcohol.
Alcohol.
Does that
okay.
count?
How often do you drink?
On the weekends, maybe a drink or 2 or 3,
Okay.
just depending. Not a lot, but
And no drugs. Do you feel safe in your home environment?
yes.
Okay. And let's see here. And we kind of talked about your job, and you're exposed to radiation, bloodborne pathogens. Do you feel like you're protected adequately, or do you have any concerns there?
No, I don't.
Okay, good. How do you feel your health is?
I feel like I'm probably in better health now than I probably ever have been.
Wonderful.
So,
Good. Well, do you have any other questions for me or anything I can help you with?
I don't think so.
All right. Well, it's been a pleasure taking your history.
Thank you.